Hello, welcome to HealthformatioNation. Are you ignoring your pain? I wanted to ask you that question because several times we've had people come into the ER and they said, I've had this pain for 2 weeks. I've had this tooth pain for a month, but I haven't gone to the dentist. Or I've had this headache, this annoying headache for hours and hours or days even. Please don't ignore your pain. The reason why I say that is because our bodies have these pain receptors for a reason. It's telling us something's wrong. If you have a history of high blood pressure and all of a sudden you have this excruciating headache that just won't go away, even though you take Tylenol, you take Motrin, everything you take, it just doesn't work. Something's wrong, guys. Please don't ignore that pain. Pain is there for a reason. It's there to protect us, actually. It's to let us know that something is wrong. So, like I said, high blood pressure. You have some people come in and they say, I've had the worst headache that I've ever had. And then we do a CT scan or a CAT scan and it seems like they're having a brain bleed or something, God forbid, or they're having a stroke. And a brain bleed is a form of a stroke. So please don't ignore that. How do you get a headache with high blood pressure? Well, because when your blood pressure is high, it will cause your head to hurt. Now, without going into all of the mechanics of it, the anatomy and physiology of it, just know that if your blood pressure is really high, higher than it's ever been, we've had people come in that were having strokes, facial drooping or whatever, and slurred speech. And the family said all of a sudden they started talking funny or their face looked funny. And then they started complaining of a headache. And that's when we brought them in. The blood pressure is 212 over 110, That's a really dangerous blood pressure. So that pain was telling them, that head pain was telling them something's wrong. It is important to note here that if you have high blood pressure, that you maintain it by taking your medications and keeping it as low as possible. When this pain increases in your head, that can be an indication that the pressure within the blood vessels have increased. This can cause other problems. It can cause issues with your brain, causing these blood vessels to leak blood and sometimes a lot of blood, which can cause a brain bleed, and that causes other issues. So please stay on top of your blood pressure. Keep it as low as possible. This information is not medical advice, so please call your doctor immediately if you have a blood pressure that is consistently above 180 over 100, in spite of taking your prescribed blood pressure medications. Treat this as an extremely high blood pressure and treat it as a medical emergency, because this is known as a hypertensive crisis. You may even need to go to the ER to get it rechecked and treated. Or if you've had, like I said, a toothache. Some people come in, had toothaches for weeks until it just got to the point where they couldn't bear it anymore. That is pain. And I've had tooth pain. I've never had it to that level, and then we ask them, when was the last time you went to the dentist? Well, they can't remember, or they can't get in, or, they're trying to get in as soon as possible. And then it's to the point where it's an emergency and they're in the emergency room for pain relief. Please don't ignore it. That tooth pain can turn into a really bad abscess, which an infection that's in your gums can go all the way down to your root, and believe it or not, it can actually travel to your brain tissue, and it can affect your overall brain health. So don't ignore tooth pain. It can really escalate to something worse. Tooth decay, any of that. Stomach pain. If you have a really bad stomach ache that just will not go away, or it's radiating down to your groin area, to your belly, don't ignore that. Especially if you still have your appendix. There's some people come in with really bad groin pain. Pain that's down here, that's radiating down here, that can be a recipe for disaster. Or pain that's radiating around your belly button, or, staying in the belly button area, don't ignore that. Shoulder pain, chest pain, any of it, especially with women. Women sometimes will have chest pain and then they could possibly be having a heart attack. But we present differently. Women, if you're having jaw pain, oh, my jaw hurt and it just won't go away. My neck hurt and it's running down my arm. I have shoulder pain. I have arm pain. Any of that kind of pain, we can be having a heart attack and we're presenting differently than men do, believe it or not. So women, don't ignore the jaw pain. Don't ignore the head pain. Don't ignore any pain. Just be mindful of that, especially if you have high blood pressure, diabetes, high cholesterol, any of those, we call them comorbidities, which are, people who have a lot of diseases and stuff that can add up, that can cause a big problem one day. You don't want to ignore it. Stomach pain, like I said, it can be your intestines. You can have intestinal disease or, inflammation in your colon. It could be anything. So I can throw out hundreds and hundreds or many diagnoses that can alarm you or scare you unnecessarily. I just don't want you to ignore it. And please don't consult Dr. Google. Dr. Google's not an MD. He didn't go to medical school. He didn't go to years of residency to learn all how to diagnose. So please, if the pain persists, no matter what you're taking, it's just not going away, do not ignore it. Our bodies are protecting us for a reason. So I just wanted to share that, because in the ER, we see all kinds of cases, and we see some cases that may not be so bad, or some that escalate to something really bad. If you have a history of kidney stones, you have back pain. Kidney stones can present as back pain, flank pain, pain that's on your side, that's radiating to your back, or even radiating to your stomach or your shoulder. It can all be related. So don't try to self-diagnose yourself by consulting Dr. Google or any other search engine. Just be mindful of it and know that your body is really warning you that something's wrong. If your stomach's aching or cramping, it could be that you're just hungry. Maybe if you just eat something, it'll go away. Or it could be heartburn. It could be anything, guys. So don't ignore your pain. Your body is having pain for a reason. It's telling you something's wrong. And I just want you to check that out, please. I'm not going to be long-winded with this video. I just wanted to do a quick don't ignore your pain video. And I could do one that's more in depth of different pain levels and different pain that you might want to consider looking into. But I just wanted this one to be quick to tell you. Pay attention to that pain. It could be telling you something, especially if you're having a headache. That's the worst headache that you've ever had in your life. Like, please. There's been people who've had brain aneurysms, because they had the worst headache that they've had in their life. And luckily they got to the ER in time, and they were able to be rushed to surgery, emergency surgery, to get it taken care of. But some of them didn't make it in time. So please do not ignore your pain. I am going to say that again. Don't ignore your pain. It's there for a reason. All right? Especially pain that will not go away with pain medication. It could be telling you something. So that's it. I want you to take care of yourself, because we want you to be here for a long time, a long, healthy life. All right? That's it for me. You have a great day. Take care.